Welcome, everyone. Thank you for joining Continuous Learning with Bioguard. It is my pleasure to introduce our webinar speaker, Dr. Louie Guang. Dr. Guang holds a Doctor of Veterinary Medicine degree and a Master's in Veterinary Histology from Konkuk University in Seoul, Korea. He further pursued advanced studies, earning a second master's degree in natural oriental medical drugs, followed by ABD PhD status in neuroscience at Danjun University in Danjun, Korea. With expertise spanning histology, drug development, and neuroscience, Dr. Guang also has 13 years of clinical experience. Currently, he serves as a diagnostic product specialist at Bioguard Corporation, Taiwan. In today's lecture, Dr. Guang will discuss canine urinary tract infection. The UTI is a bacterial infection affecting the ureters, bladders, urethra, and potentially the kidney. As a common condition in dogs, UTIs are a major driver of antimicrobial use. If left untreated, they can lead to recurrent infections, kidney damage, and sepsis, posing serious health risk. We are thrilled to have him as our speaker for this webinar. Without further ado, please join me in welcoming Dr. Guang.
Hello, everyone. Thank you, Dr. Robert. Welcome to our webinar. We will get started. Today's subject is urinary tract infection in dogs. And as you know, when we were in college or in veterinary school, we all heard about antibiotics. And it is very easy subject because we heard in our classes, for example, internal medicine, pharmacology, and class, or in toxicology class, we heard about it. So part one, our webinar, we'll talk about the introduction and symptoms and diagnosis and treatment and prevention. First, introduction. When dogs come to the clinic, usually we ask questions. How many times does a healthy adult dog urinate per day? And usually how many times this dog go to urinate? And if our clients say 3 to 5 times or 6 to 7 times, is all within normal range. Normally, usually, dog urinates 3 to 5 times, and suddenly, dog go to urinate over 10 times. That's not normal. So we can see by urination time, we can see the clinical signs. Are UTIs in dogs common? Yes. Urinary tract infection in dog is a common problem in veterinary medicine. In statistics, about 14% of dogs that visit a veterinarian in their lifetime have UTIs. In fact, more than 14% have UTI infection. So it is a very common symptoms. Then next, we will look at what are the UTIs in dogs. So urinary tract infection is the presence of bacteria, sometimes fungus, in the urinary system that cause disease. It is often caused by bacteria that are typically found in or around the the rectum, skin or hair near the external urethral openings. So from the outside urethral opening, traveling through the urethra into the bladder. So next we'll see the causes of UTIs in dogs. Usually poor hygiene around the genital area causes UTI, and incomplete bladder emptying because of the infection causes UTI. And dogs with immune system problem have UTI due to the old age or disease conditions. Usually senior dogs have weak immune system problems and easy to get UTI. And these underlying conditions include diabetes or bladder stone. If you look at the X-ray imaging, we can see the bladder stone. And this kind of condition is one of the cause of the UTI. And anatomical abnormalities, for example, ectopic ureters and recessed vulva is also the underlying condition. If you look at the picture on the right side, if in normal ureter enters the urinary bladder from the kidney, the ureter enters the urinary bladder, but abnormal ureter doesn't even touch the bladder, just connect to the urethra. This kind of abnormalities in anatomical structure, also one of the underlying condition. And some breed, like Scottish Terrier, they are easy to get bladder cancer. This kind of tumor or cancer, bladder cancer also the cause of the UTI. And if you apply the urinary catheter very long time and prolong the use of the urinary catheter is also one of the reasons of the UTI. So the most common bacteria to cause UTI infections are E. coli and Staphylococcus, Streptococcus, Enterococcus, Enterobacter, and Proteus, and so on. So in today's webinar, we will only focus on bacteria. If the UTI is passed with more than 3 urinary tract infection in the past 12 months, we will classify as a complicated or recurrent UTI. Usually in this complicated recurrent UTI, underlying medical conditions or other disease cause this kind of recurrent UTI. And dogs who has recent antibiotic usage, so already used antibiotics, make it resistance. It makes us to make it hard to use another antibiotics. So we classify this type of UTI as complicated UTI. The simple or uncomplicated UTI, we call it usually less than 3 infections in past 12 months. So in simple case, no predisposing factors or other disease present. If you look at the anatomical structure of the dogs, from the outside urethra and connects to the urinary bladder, and 2 ureters connect to the kidney, which filtrate the blood and perform the excretion function. And if you look at the male dogs and female dogs, from the outside, the distance from the rectum, female dogs are much closer. So females get UTIs more often than males because of this kind of anatomical structure is kind of one of the factors. This is the same in human. So female gets UTI more often than males, but any age and breed can be affected. And middle-aged or older senior dogs or immune system, weak immune system dogs, dogs with certain complications get affected. So pregnant dogs can press the urinary system, and dogs with certain complications like Cushing disease, diabetes, or other kidney disease. So existing disease can affect the UTI predisposition in dogs. Some breeds tend to get UTI easily. Breed-specific predispositions, for example, Schnauzers and Dalmatians, tend to have, they are prone to developing crystals or bladderstones, are at a higher risk of developing UTI. And Yorkshire Terrier, Shih Tzu, and Poodles, this kind of breed has long hair and easy to, they're nearby their outside anus, easy to get contaminated or become dirty, and it can connect to the UTI infection easily. And next, we'll briefly look at the symptoms and diagnosis. Symptoms of UTI in dogs, we can see frequent urination and drop by drop urinate or try to urinate, but very hard to urinate. And we can also observe painful urination, and sometimes small amount of urine comes involuntarily. And some dogs have frequent urination. This kind of all symptoms all included the symptom of the UTIs. And some dogs cannot hold it, and urinary accident happens, and they are very thirsty. So increased thirst also can be observed. And leaking genital region of the inflammation, and sometimes with salivary staining to copper coloring to the fur from spit, and blood urination is a big warning danger signs, and genital discharge, and increase the bad smell, the odor, or the urine color change to the cloudy is also symptoms of UTI. And in diagnosis of UTI, physical examination, urine analysis, and urine culture and susceptibility tests are included. In physical examination, look for the signs of disease and inflammation in urinary tract and genital area. And urine analysis, you check there's a blood included in urine or not, and we check the white blood cell for the inflammation checking, and bacteria checking, and crystals in urine. And urine culture identifies the specific bacteria causing the infection, and we check the susceptibility for to use the most effective antibiotics to overcome the resistance. In physical examination, we palpate the abdomen, bladder area, and check if dog feel painful or they show aggressive. And check dog's urinary tract and genital area and looking for the physical signs of disease or inflammation. And in male dogs, rectal exam also are helpful, and musculoskeletal exam or neural exam are also helpful. And sometimes we need to check the signs of arthritis. In urine analysis, we put the needle to the urinary bladder and cystosynthesis perform, and after collection within 30 minutes, we analyze the urine. And if the urine is normal and it shows the light yellow color, but if it's dark and red, cloudy or very diluted urine may indicate this dog has a health problem. And urine's clarity and turbidity we should check. And if it's clear, if that's normal, but if it's cloudy, and it could mean infection and crystals or other status mucus in urine, we should check. And strong smell and odor and foul smell may suggest the bacterial infection or ketones as in the diabetes. In urine culture and antibiotic susceptibility test, the urine sample is often sent to the reference laboratory. It usually takes at least 2 or 3 days, sometimes to get it back. It takes 5 days, 4 or 5 days. The sample will be spread in a plate and analyzed for bacterial growth, then analyzed specifically for the type of bacteria present. For example, E. coli or Staphylococcus. We can specify the type of bacteria that is a benefit for using the reference laboratory. However, it takes very long time for correct diagnosis. The bacteria is tested against multiple antibiotics to see which is the best to use for the treatment. Diagnostic equipment such as mini-AST is an in-clinic antibiotic susceptibility analyzer, and mini-AST can test the susceptibility of antibiotics faster than sending to the reference laboratory. That's the advantage using the mini-AST. We can check the susceptibility as fast as 8 to 18 hours. So, for example, if we use the mini-AST result, we can check if this antibiotics is susceptible or resistant or intermediate. And if you see the report, you can choose the antibiotics, susceptible antibiotics for the effective treatment. And if you look at other supporting tests, we can check the blood work, imaging, biopsy, and prostate wash with cytology. And pets with disease or senior dogs, we need to check the blood test, and through imaging, we can confirm the radiographs using the radiographs and ultrasound or other cystoscopy, we can check the blood, bladder stone, or and other imaging evidence. And the bladder biopsy is sometimes very helpful. And in male dogs, checking the prostate is sometimes necessary. Okay, next we'll see the treatment and prevention. Dog UTI treatment, if dog has simple or first time in UTI, we can use the broad spectrum antibiotics typically prescribed for at first maybe 3 to 5 days, and check it again, and later maybe 12 to 14 days, and amoxicillin and cefalexin and TMS, this kind of antibiotics can be used. And if it's in complicated case, and longer antibiotic treatment can be applied. And we need to repeat the urine culture and investigate for the underlying disease. For example, bladder stones, tumors, or diabetes. In antibiotics treatment, because of the resistance, sometimes it is not easy to treat as expected, because the resistance goes up and up, and treatment by antibiotics is not always satisfactory as we expected. There are several antibiotics options for UTIs in dogs. Here's the list of antibiotics. Among these, for example, amoxicillin and ampicillin, we need to use with caution. If locally the resistance rates are high, we should be careful. And ciprofloxacin, this kind of antibiotics, this kind of fluoroquinolones, we use with caution due to the resistance and potential side effect. And we should limit the usage if possible. Nitrofurantoin is effective as single-dose treatment for uncomplicated urinary tract infections. And fosfomycin, effective as a single-dose treatment for fosfomycin, effective as a single-dose treatment for uncomplicated urinary tract infection. And nitrofurantoin contraindicated in patients with impaired kidney function or renal function patient. In treatment of UTIs in dogs, usually caused by bladder stone or crystals or polyp and cancerous mass or anatomical malfunction, ectopic ureters, we cannot just use other treatment. We need to do surgery or dissolution diet, or in case of cancer, chemotherapy is necessary. And recovery and management, symptoms often start to get better after a few doses of right antibiotic. and it's important to finish entire course of the prescribed antibiotic treatment. It is better to recommend repeating the urine culture during treatment, as well as a week or two after finishing the antibiotics to make sure the infection is gone. It is the same as when you take the drugs. Make sure the symptom is gone, and otherwise, infection can come back recurrently. And diet change from dry animal diet to wet animal diet, like a canned prescription diet, can be helpful. And increase dog's water intake is also good management for UTI. For the prevention, for male dog, the grooming of the perpetual hair can reduce the skin bacteria. And for female dog, keeping the vulvar region of the female, make it clean is important. Overweight females for female dogs and females who had hooded vulva are prone to get UTIs, so use pet grooming wipes to clean after urination is helpful. So to prevent the UTI, it's important to give the dog the time to urinate comfortably. So regular potty breaks are important. Some dogs only urinate when they go out one time per day. It can increase the chance of getting UTI. And access to clean, fresh water are important, and maintain a healthy weight and diet. And regular veterinary checkups are, especially for diabetes or senior dogs, are very important. So part one contents are very easy, and conclusion is UTI in dog is a common problem, and there are several diagnoses and treatment methods for UTIs in dogs. And selecting susceptible antibiotics will be an effective way. Thank you very much indeed for the part one. And in part two, we check the urinary tract infection and traditional antibiotic treatment. And in part two, the following content may differ from the direction pursued by Bioguard Corporation and reflect my personal opinion of the instructor. If you look at the left paper, trimethoprim in combination with the sulfonamide in oral treatment of canine urinary tract infection. This is the combination therapy suggested. However, this paper came out 1979. Antibiotics we use doesn't work because it came out very long time ago, and we are still using it. Although we select using the susceptibility test, we selected it has developed very, very long time ago. And if you check the right paper, the approved antibacterial drugs in the last 10 years from the bench to the clinic and show the improvement of antibiotics in the last 10 years and show the recent development. So antimicrobial resistance because of antibiotics goes to the companion animal, and also we use it in industrial animals, and a human being consume the meat from the industrial animal and from their waste. We got it from the plant and for environment, and we also human get resistance from various ways. So this is the WHO antimicrobial resistance, and this they declare this is one of the top global public health and development threat, and global concern has rising and from long time ago, and there's no complete solution for this. And current situation, there are many resistance, for example, drug resistance in bacteria and fungus and other things. And if we only focus on drug resistance in bacteria, it's not easy to overcome. And WHO said antibiotic resistance, how it spread. So antibiotic resistance happens when bacteria changes and become resistant to the antibiotic used to treat the infection they cause. Usually bacteria get information about antibiotics. They share the information with other bacteria and increase the resistance. This is WAH for animal part, global governance on antimicrobial resistance. So they insist we need to have a strategy and use the facilitators, for example, advisory group and cooperation and funding, and we need to implement to the national action plans to manage the antimicrobial resistance. So WHO and WH both worry about antimicrobial resistance and put a lot of effort, but very long time, but it is not easy to decrease the resistance. If we look at the future of the antibiotics, if you look at this paper, you can see why it's not easy to develop good antibiotics. If you look at the science and economics and regulatory bodies, many pharmaceutical companies, for them, R&D is kind of too risky and expensive, and the good result is not guaranteed. And so if we see the science and economics and regulatory body, there's a reason it's not easy to develop good antibiotics. So antibiotic stewardship is a careful antibiotic. The careful and responsible management of antibiotic is kind of necessary from now on. From a long time ago, we tried to manage it well, but the more and more the situation was getting worse. And if we look at the human and animal and environment, and core element of antibiotic stewardship are these kind of factors are necessary. And we should be aware of our role for use when you use antibiotics, and every member of the society should have a careful approach. And there are 10 rules for antimicrobial therapy. First one is enhancing antimicrobial stewardship program and infection prevention and control, and efficient source control, prescribing antibiotics only when they are truly needed, and define a microbiological diagnosis, prescribing appropriate antimicrobials with correct dosage. And next one is antimicrobial timeout, and using the shortest duration of antibiotics based on evidence, and educate the staff well, and supporting surveillance and watch it well, and mentioning of antibiotic consumption, and supporting an interdisciplinary approach. These are 10 rules for antimicrobial therapy. So until now, we use antibiotics a lot, but however, without substituting solution, the resistance is going up and up. Day by day, it's hard to use it more and more. So we will still have antibiotics in 50 years. And when they asked the global expert, they all said yes, because we don't have other better solution. That's our reality. And the World Health Organization says we are currently losing to the bugs, losing to the bacteria, with resistance increasing and too few new antibiotics in the pipeline. Recently, there's a good news from FDA. FDA approves first new antibiotics for urinary tract infections in nearly 30 years. The drug Bioguard from GSK provide a new treatment option as bacteria increasingly become resistant to the standard antibiotics. So improving antibiotics coming out is good news. So if you look at the recently approved innovative antibiotics, we look at the two antibiotics. First one is a gepotidacin. Brand name is Bioguard. It's a oral antibiotics for uncomplicated urinary tract infections in women and adolescents. The mechanism is a novel dual inhibition of bacterial DNA gyrase and topoisomerase 4. So that's different from previous fluoroquinolones. And FDA approved March this year, and it will be launched in June. Supposed to launch in June, and show higher success rate compared to nitrofurantoin. If you look at the success rate, it's from 43% to 50%. Even though it's a innovative antibiotics, you can see how difficult to improve the efficacy of the antibiotics. And if you look at the further use, also undergoing phase 3 trials as a treatment for gonorrhea, so with promising potential. So it can also use for the gonorrhea treatment. Is kind of good news. The next one is azithromycin. So avibactam. So brand name is Emboravel. So the treatment for complicated intra-abdominal infection and urinary tract infection caused by gram-negative bacteria. So this one is a combination mechanism and combine a monobactam with a beta-lactamase inhibitor to overcome the resistance. So they got approval in EU in last year and FDA February this year. I think first one, Bluejepa was developed by GSK, and second one with Pfizer and Abib Inc. Together. So we saw many antibiotics, but there are no magic in overcoming antimicrobial resistance in antibiotics. So which threaten globally the human life. Hopefully, there is a hope in our Pandora's box. Those are newly approved antibiotics and new next generation antibiotics. So next step, we look at the new next generation antibiotics, NGA. So if you look at the lab paper, the breaking bacterial communications, the future of next generation antibiotics. We're talking about the communication between bacteria, and if we can break it, we can make the more effective antibiotics. And second one, on iterative approach guide discovery of FABI inhibitor, fabimycin, is an antibiotic candidate, late stage antibiotic candidate with in vivo efficacy against drug resistance gamma negative infections. It's another NGA. And FDA accept new drug application for joliflodacin for uncomplicated gonorrhea from urology times, and also AI-guided antibiotics discovery pipeline from targeted selection of compound identification. So we get help from the AI to design, and when we discover the pipeline from the target area, it's kind of new approach in next generation antibiotics. If you look at this Nature paper, using next generation antimicrobials to target the mechanism of infection, recent science improvement, signal transduction, and study on the receptor, and transmitter, and the new next generation antibiotic is a new target and precisely target the inside cell molecules. So next generation antibiotics, NGA, is an innovative antimicrobial agent designed to combat bacteria that have developed resistance to conventional antibiotics, such as superbacteria. And for example, MRSA, CRE, and Pseudomonas. These drugs features a new mechanism of action and advanced drug delivery method and cutting-edge technology like AI or synthetic biology in the development. So how next generation antibiotics are different from current antibiotics? We are trying to overcome the resistance, and new antibiotics are being developed to target multi-drug resistance bacteria. For example, tedizolid is more potent than linezolid, effective against resistant gram-positive bacteria. The next one, ceftolozane, designed to combat resistant gram-negative bacteria like Pseudomonas. And targeted therapy, second one is targeted therapy. Researchers are working on precision antibiotics that selectively kill harmful bacteria without disturbing beneficial microbiota. And nanoparticles also used, and antibody drug conjugate are also used for targeted therapy. And third one is a non-antibiotic alternative. For example, the sources from the natural drugs or bacteriophage therapy and antimicrobial peptide or CRISPR-Cas9-based gene editing, those kind of technologies using for non-antibiotic alternatives. And artificial intelligence, AI-driven drug discovery is also used to help discover new antibiotic molecules, repurpose existing drugs, and optimizing drug combinations more efficiently. And recent notable approvals already talk about the Bioguard and Antimicrobial. This kind of improved antibiotics in human will affect later will apply to the veterinary medicine. So it is also good news. So in summary table, currently approved antibiotics and currently developing antibiotics are showing. And if you look at the mechanism, for example, novel ribosome site, new antibiotics class, or novel beta-lactam intrinsic resistance, this kind of new mechanism is used. So part two conclusion is there is no magic for antimicrobial resistance, but showing up next generation antibiotics is anticipated and will affect our animal medicine area. That's all for today's webinar, and thank you for your participation. And if you meet us around the world in conference. Wasaba in Brazil and Wasaba in Korea this year, and London Vet Show in the UK, and VMX in the US. You can meet us around the world, and you can we will have a booth, and you can join us and check our product. For example, Mini ST. Thank you. And we'll check several questions. So I'll read the question right now. The role of urinary pH modifier in dogs. The urinary pH modifiers plays a role in managing the canine urolithiasis, the bladder and the kidney stones, and by influencing the solubility and excretion of minerals in the urine. So by adjusting the urines, the acidity and alkalinity, the urine's pH, these modifiers can help dissolving the existing stone. But if the surgery is necessary, of course, we need to do surgery, but the changing the pH prevent the formation of the new one. So that's kind of the role. And is there any change of fever in UTI? Yes, there's a. Is there any chance of fever in UTI? Yes, there's a chance of fever in dogs with a urinary tract infection. But not all dogs with UTI will develop a fever. So it can be a symptom, especially in case of upper UTIs involving the kidney, or when the infection is severe. So, and lower UTI and affect the bladder and urethra, and common symptoms include frequent urination, straining to urinate, and blood in the urine, and leaking the genital area. And okay, other questions will answer you by email. We'll send the PDF of UTI by email. Thank you very much for your participation.
Thank Dr. Guang for his excellent lecture. We'll see you again in our next webinar. Thank you and good night.